The World Health Organization could soon decide whether or not to declare an end to the COVID-19 global health emergency. A group of experts and health officials from around the world are meeting today to assess the situation. The WHO first gave COVID-19 the highest level of alert in January of 2020, and it has kept that level in place ever since, at meetings held every 3 months. That status has helped maintain international focus on the pandemic. The WHO advisors say that there is no consensus yet on which way the panel may rule, and that the meeting could continue for several days. Trent Murray joins us live from Berlin with more details on that meeting. Trent, is there any sign at all of which way the panel is leaning in terms of making this decision?
No, Dawn, there's not. We've not had any white smoke, so to speak, from this panel, which is meeting right now to really decide whether the world is ready to take its first steps out of the pandemic without this highest alert level in place. Now, what we do know is that the panel is incredibly split. It includes independent members from both the health sector, but also the legal sector and civil liberties groups, trying to find that balance between keeping that warning in place and also lifting some of those measures in order to give personal freedoms back to people. Now, what we do know is that some of the opinions going into that meeting included ones from legal professors that said, effectively, look, you cannot keep this emergency level in place forever because that will detract from its meaning and from its definition. People will start to pay less attention if it stays in perpetuity. But then you've got others like virologists who are saying, look, this virus is still very, very unpredictable. There is data being released, particularly, as you mentioned, from Asia and the Pacific, showing cases still rising. And for that reason, it's just not the time to take the foot off the gas, if you will. So we do expect this meeting could last potentially for several days. The WHO does know there is a lot riding on this and that there is a lot of global attention on it. But what we also do know is that the WHO's Director General, Dr. Tedros Adhanom Ghebreyesus, has said in the past that he expects this emergency level to be lifted this year. The key question is whether it will happen now or potentially a little bit down the line. We just do not know. But a number of health experts across Europe and Asia and the US are watching this meeting very, very intently to try and get a sign of whether the WHO may be sending a signal that we may just be starting to get out of the woods.
Trent, if the WHO were to decide to end the COVID emergency, what changes might we expect?
Well, a lot of individual nations are relying on the WHO for guidance and advice in how they craft their own laws, their own restrictions. It's often a bit of a backstop and an explainer, if you will, for people to be able to say the WHO does still class this as an emergency. Some experts say that by removing that label, it will hamper communications efforts, also fundraising efforts on the virus. But others, again, are saying, look, it really is time to live with this disease in the same way that we live with, say, HIV or tuberculosis. So I imagine right now inside of that room, there is some very intense discussion and debate taking place to decide what to do next. But of course, we also know that a number of countries are not necessarily following WHO advice and are lifting restrictions or have lifted them already. So, I mean, it really is quite an unpredictable situation. But what we do know, of course, it is just a huge watershed moment, given this has been in place since January of 2020. We may be about to see a major change in how the world tries to live with COVID-19.
A watershed moment indeed. Trent, thank you very much for that. Trent Murray there reporting live from Berlin.
On the story, we're joined by Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. Professor Cowling, we just heard there from our correspondent. Essentially, COVID-19, the decision to be made, it's either an emergency or it is not. It's an all or nothing kind of decision, which is dangerous if you consider, as our correspondent also mentioned, it is, as some virologists say, it is still unpredictable and therefore potentially dangerous. If you decide emergency or not emergency with nothing in between, this is a decision that is at best misleading, at worst dangerous.
Well, that's right. It's not an ideal situation because I think clearly we've been in a much worse situation earlier in the pandemic, and the emergency declaration was fully justified. Right now, I think we're no longer in a state of emergency, but at the same time, it is not yet the right time to sound the all clear. As we heard, there's rising hospitalizations in many parts of Asia. Vietnam's reintroduced a mask mandate. We're still worried about the virus. It hasn't gone away. It's still causing a lot of infections, a lot of hospitalizations. So we have to have some kind of alert level, but maybe not the highest level of alert from now on.
So what kind of alert level can there be, an in-between one?
Well, for DEFCON 1, 2, 3, 4, 5 in the US for their nuclear emergencies. Maybe we need a system more like that with pandemic threats, where we can come down from the highest levels, but we can say that there's still a need to stay on alert and prepare for surges in infections. And maybe from time to time, we might need to bring a few of the measures back. I don't think we'll have lockdowns again, but mask mandates maybe in some places, maybe some other measures as well. So maybe we need a new scale that reflects that kind of grading, maybe a 5-point scale, for example.
Well, in fact, the World Health Organization, before coming to decide on this, has released a report recommending how the world should look longer term in terms of sustainable management control of COVID-19. Should we not be taking direction, instruction from that rather than from a single decision on whether or not this is a matter of international emergency?
Well, I think that's right. And of course, in different parts of Asia, there are also different challenges, different concerns, different resources available, different possibilities. So I don't think that one solution will fit every location, but we know particularly that vaccines and vaccine boosters can make a big difference for older adults. And the rising hospitalizations we've heard about, many of those people in hospital now with COVID have not had a booster in the last year, whereas people who have had their booster are going to be protected against being hospitalized with COVID. So that should be one of the major focuses, increasing booster vaccination uptake, particularly in older and more vulnerable people.
All right, as an epidemiologist, you will know public health is not just managing something medically, clinically, it's also a psychological exercise. So, for example, Indonesia, which is something we didn't mention earlier on, the rise in infections and the number of deaths. So their head of this particular specialty mentioned that in the last 7 days, of the 16 people who died, all 16 had not got their 4th jabs. And of the 16, 10 had not gotten vaccinated at all. So the sense of urgency that we had earlier in the pandemic, which got all of us out getting our booster jabs, getting our vaccinations, taking all sorts of measures, that is lost. So that has to be brought back to prevent deaths like these. Short of an emergency staying in place, what more can we do?
Well, I think we do need to find a more sustainable approach, because we can't keep the emergency in place forever. And I think things like booster vaccinations are things we're going to have to administer every year, and find strategies to get booster vaccination coverage up to higher levels so that we can prevent more of those hospitalizations. That's a challenge, because in the past we've had the emergency status, really a lot of pressure on people to get vaccinated. Now there's some almost mixed messages. If we say the pandemic's over, but actually we still need to be on the alert, and we still need to try to promote booster vaccinations from year to year. So that's a challenge for countries in this transition period out of the pandemic.
And finally, final question, and clarify this for us, because I remember up to about the end of last year, we were still hearing health experts saying we need to be careful because subvariants, which could be potentially far more lethal, far more infectious, could then emerge, and far more infectious than the ones that we're dealing with right now. But that has quietened down the last few months, at least in this year. What do we know now of the coronavirus? Is it less likely now that we will see a more deadly variant? Is that likelihood less than it used to be? What more do we know of how it infects us? How frequently? What kind of waves of infections can we expect in the future from the coronavirus?
We've seen the Omicron variant being the dominant variant now for well over a year. It's changed a number of times. Remember, we have BA1, BA2, BA5, XBB, and so on, and now it's changed again. As time goes on, And in our populations, we have more people getting vaccinated and getting boosters. We have more epidemics of infections as well. The level of immunity in the population goes up. That means on average, infections are going to get milder because the immunity that we have from vaccines and infections brings that severity level down over time. So I don't think we need to worry so much about severe new variants, but there is going to be continued waves every 3 or 4 months of infections and some people getting hospitalized, particularly older and more vulnerable people, and particularly, as you mentioned, if they haven't had a recent booster. So the booster coverage is really a critical statistic now.
Thanks very much indeed. That was Ben Carling, Chair, Professor of Epidemiology at the University of Hong Kong.